This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good Monday morning. The week begins on WAJR with Mon Health Talk. We appreciate you joining us, and we've got a couple of guests with us this morning, Dr. Matthew Gaskill and Dr. Salam Sbaity. And first of all, Dr. Gaskill, good morning to you. Thanks for coming on.
Good morning. Thank you.
Dr. Sbaity, good morning.
Good morning. Thanks for having us.
Dr. Gaskill, go ahead. Give your background. I know you've been on here before, but your training, your background, and your specialty at Mon Health.
Well, I grew up in northern Illinois in a small town called Dixon, and from there I went to college in Chicago, med school in Kansas City, Missouri. I did some of my training in the Detroit area for internal medicine and cardiology, and then I did my electrophysiology fellowship in Boston, and that's what I do now. I'm a cardiac electrophysiologist.
Mm-hmm.
And part of a team of 3 electrophysiologists here at Mon.
Dr. Sbaity, what about your background and your specialty?
So I'm also an cardiac electrophysiologist, originally from Lebanon. I did my medical school at the American University of Beirut, and I did my residency, cardiology, and electrophysiology fellowship at the University of Iowa.
Okay. Electrophysiology. I'll let you define that, Dr. Gaskill.
Well, I often tell patients that I'm like a heart electrician because it gets a little confusing. But basically, electrophysiology is a subspecialty within cardiology that deals with the heart circuitry. So we treat things like abnormal heart rhythms, whether it's a slow heart rhythm or very rapid heart rhythm. We specialize in procedures like pacemakers and defibrillators, Watchman procedures. We do procedures like ablations for abnormal heart rhythms.
Okay. And Dr. Sbaity, again, those are pretty common things that people deal with. I would imagine that kind of the technology and the advancements that have been made in the last couple of years in this field are pretty significant.
Yes, that's correct. There was a significant advancement in the treatment of atrial fibrillation. Atrial fibrillation is the most common abnormal heart rhythm, affecting probably 5% of people above 65 and 15% above 80. The most effective treatment for atrial fibrillation is an ablation procedure. It's a procedure where we go inside the heart and we cauterize or freeze the areas that initiate the abnormal rhythm. There was significant advances in the technology for treating this rhythm. One of them is the radiofrequency ablation, and here at Mon we have the most advanced ablation catheter that's still only on limited market release. We've got a good experience with using it so far. It's called the TactiFlex catheter. We also introduced a new freezing balloon, the newest technology called Polar X, which also has multiple advantages over the available old technology, including that the balloon can have 2 sizes, so it fits better into the veins. It's also more compliant balloon, so it takes the shapes of the veins. All these technologies make this procedure more effective and even safer.
Yeah, more effective, safer, and less invasive, right? Just continue on with that thought, Dr. Sbaity, in terms of, these are procedures that people have, and a lot of times they're same-day procedures, correct?
Yes, correct. We discharge almost everybody same day. It's a procedure that takes the radiofrequency ablation might take a couple hours, and yes, those patients almost all the time go same day. A lot of them are coming from 2, 3, 4 hours drives, and they're able to go home safely on the same day.
Mm-hmm. Dr. Gaskill, you mentioned the pacemaker, and I would imagine the technology there has advanced significantly. Those procedures, are they less invasive and safer than they used to be?
You know, the field of electrophysiology in general is always advancing, and there's always new things coming out, both that are more efficacious and safe for patients. And indeed, pacemakers have had some advancements. Here at Mon, we were the first in the state to put in a retrievable leadless pacemaker. Dr. Sbaity did that. They go in through a needle poke in the groin instead of making any incisions in the chest, and they're maybe about the size of a AA battery. The battery life lasts for 16 years sometimes. And so, in fact, that same pacemaker recently had FDA approval for a dual-chamber pacemaker. So I imagine in the future, most people with a pacemaker will probably have one put in just through needle pokes in the groin.
That's that really is incredible. And Dr. Sbaity, you mentioned the Polar X procedure in terms of the ablation, and can you explain that a little bit more? How that technology has advanced?
Yes, so that's a technology where we go again inside the heart from just a poke in the groin, and then we go through the vein all the way to the heart. We put an ultrasound machine inside the heart so that we're able to see all the heart structure from within the heart. And then we introduce that catheter into the veins in the left upper chamber. Those are veins that bring blood from the lungs, but sometimes they do an abnormal job of initiating abnormal electricity that causes the atrial fibrillation. So while watching with an ultrasound machine from inside the heart and occasionally using fluoroscopy and using also a mapping system that works as a GPS based on a magnetic field inside the heart too, we are able to locate those veins that initiate the abnormal electrical rhythm, and then we introduce that balloon that fits into those veins and then freezes around them so that they still do their job of bringing in oxygenated blood, but they stop doing the abnormal job of initiating electricity. Now, we just introduced the newest technology balloon, as you mentioned, to West Virginia. It's called Polar X. This balloon has multiple superior characteristics over the older balloon. It can take two sizes and thus fits different shapes and forms and sizes of veins better. And it also is more compliant balloon, so it can take the shape of those veins better. So it can reach better temperatures, and it can basically isolate them electrically better. So it's more effective, and it is safer.
It really is incredible technology, no doubt. We're talking basically about abnormal heart rhythms and the way they're corrected. And Dr. Gaskill, there are different kinds of things. I would imagine some of these are more serious than others. Can you talk about the symptoms and the causes of the abnormal rhythms that people, that people have?
That can have a wide range of things, and some things can be very much benign, and some things can be very serious. Causes can range from anything genetic to lifestyle. Rhythms like atrial fibrillation, for example, the most common abnormal heart rhythm, like Dr. Sbaity mentioned. Sometimes there's a genetic component, lifestyle component, things like having a couple extra pounds on us or, heavy alcohol consumption. Those things can sometimes increase our risk of atrial fibrillation. Symptoms can range from shortness of breath to palpitations, chest pain. Sometimes they can even be asymptomatic completely.
Mm-hmm. Anything to add to that, Dr. Sbaity?
I think that covers it pretty well. And those rhythms, as Dr. Gaskill mentioned, range from really benign rhythms to life-threatening rhythms like ventricular tachycardia that can cause sudden cardiac arrest. And for those two, we have interventions like ablations, where we use also more advanced mapping and ablation technologies, and there's new defibrillators to protect people who have those abnormal rhythms. We used to put a defibrillator with a wire inside the heart. Now there's emerging technologies with one which we've been using for a few years. And there's newer ones coming where the defibrillator sits outside the chest cavity, so it's less invasive.
Okay, and you both talked about lifestyle choices. We're talking about weight and diet and smoking. I mean, we can all be kind to our hearts, right, Dr. Gaskill, by watching our diet, and certainly if you're having any of these symptoms and you're a smoker, that's the first thing you do. Just stop.
Absolutely, and lifestyle modification, especially for things like atrial fibrillation, is paramount. And there was a study years ago that looked at, in an extreme example, patients that needed bariatric surgery and had atrial fibrillation. And one group went for an ablation, and one group went for bariatric surgery and lost a bunch of weight. And the efficacy of reducing the incidence of atrial fibrillation was pretty much the same in both groups. So that's all that to say, keep taking care of yourself is one of the biggest things that we can do to prevent things like atrial fibrillation and other arrhythmias.
Dr. Sbaity, I mean, are there medications that can help with some of these symptoms? Is it always surgery, or can some of these symptoms be controlled by taking a medicine?
Some of these diseases and symptoms can be controlled with medications. There are medications that are, disease that change the course of the disease, and those are medications that are good for the heart in general, like beta blockers or other medications that work on the neurohormonal axis in the body and that help people with abnormal rhythms and people with heart failure. Also treating any coronary artery disease, so treating the plumbing problems have a significant positive impact on the electrical problems. Now, there are special medications that target the electrical rhythm problems, and these are medications that affect the ion channels in the cells. Those usually do not change the prognosis of the disease, but just suppress symptoms, and they're usually not as effective as ablation procedures, but we still use them a lot. They should be prescribed by an electrophysiologist. Some of them would require the patients to be admitted to the hospital and monitored for a few days while initiating them.
Mm-hmm. We are with electrophysiologists Dr. Matthew Gaskill, Dr. Salam Sbaity. This is Mon Health Talk for this Monday. A lot of good information and some incredible technological advances in this field. We've discussed that in the first segment. We'll take a quick break. We will continue the conversation on Mon Health Talk after this on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
It is Mon Health Talk for this Monday morning, and we're joined by electrophysiologists Dr. Matthew Gaskill, Dr. Salam Sbaity, and in the first segment, we learned about the incredible technological advances in cardiac ablation. We talked about the Polar X system that's new to West Virginia, new to the Mon Health system. And Dr. Gaskill, what about some other advancements that Mon Health is bringing to the issue of heart and vascular health?
Well, in the field of electrophysiology, there's always advancements, and we're here at Mon, we're doing a good job of staying on top of those advancements. We were the first in the state to use the Polar X balloon. Dr. Sbaity was the first in the state to implant the retrievable leadless pacemaker that we mentioned earlier. There's also a new Watchman that's on limited market release that we'll be implanting that has extra sizes to accommodate more anatomy, a different coating to allow for a faster healing process, and we're involved in that. And there's really more to come.
Mm-hmm. Dr. Sbaity, what has you excited about the future of this medical field?
We have the most advanced mapping system and radiofrequency ablation catheter. It was also the StackDeflex catheter is on limited market release, and we've got a good experience using it. I'm looking forward for us to be pioneers in introducing pulse field ablation, which is a new exciting modality of ablation, which would be more specific for the heart tissue and less invasive for tissue around the heart. So it will probably also improve our effectiveness even more and make the procedure even safer. We're looking forward to be pioneers in West Virginia in introducing this technology, and we're already in communication with the companies to bring it to West Virginia as soon as it's approved by FDA.
You mentioned I'm sorry, go ahead.
Go ahead.
Well, you mentioned the mapping aspect of it and a device that kind of acts like a GPS type deal. Can you explain that a little bit more and how that works and what the advantage is?
Yes, thank you for asking. So in electrophysiology, we use imaging to guide us to perform the ablations, and that has multiple forms. One of them is the ultrasound, where we image the heart from inside the heart using ultrasound. The other would be radiation, which is the older way of doing ablations. And then there is the mapping system. So that is a system where we put magnets around the patient, and then we are able to localize catheters and mapping catheters, as well as we can create a geometry of the heart itself. So then we can see an image of the heart on a computer screen, and we can see the structures of the heart as long as we create that geometry. And then we can see our catheters moving inside the heart, exactly like the GPS would guide the car around in a city. And we were the first to bring the Insight X, so it's the most advanced mapping system by Abbott, to the state of Virginia. And we've been using it now for more than a year and a half. So we've got really superior experience with it.
That sounds incredible. Well, Dr. Gaskill, we're down to about the final minute here, and I'm assuming that you and Dr. Sbaity both work out of Mon General?
We both work out of Mon General. There are several satellite clinics. I, for example, work at Morgantown. I go to Preston, as well as a clinic in McHenry. Dr. Sbaity goes to Morgantown. He'll go to a clinic in Stonewall. He goes to Elkins, as well as Fairmont.
Okay, so no matter where you're out there listening to this, you have an opportunity. How do people get in touch with you, get in reach to get something going if they're having some of these symptoms and they'd like to see you?
Well, they can, number one, always find more information at monhealth.com/heart. Our office number is also 304-599-8802. They can call with any questions.
All right, very good. Well, gentlemen, this was very informative, very interesting, and it's incredible to be on the cutting edge of this technology. And it's right here in North Central West Virginia and Morgantown and the Mon Health System. Again, thank you both for your information and your time today.
Thank you for having us.
Thank you for having us.
Dr. Matthew Gaskill, Dr. Salam Sbaity with Mon Health. And this is Mon Health Talk for this Monday. Thanks for listening. 104.5 FM, 1440 AM, WAJR.